Did you know that your weight and heart health are interconnected? We're going to talk about this interconnection between how obesity is linked to heart disease. Hi, my name is Alana Meadows, and I'm currently an obesity medicine fellow at UT Houston in the Center for Obesity Medicine and Metabolic Performance. Today, we're going to be talking about obesity and heart health and understanding the connection between the two, and end the talk discussing about how you can use this information when discussing plans with your healthcare providers. I hope that by the end of this talk, we'll have a better understanding of how obesity affects heart health, including its impact on several different metrics like blood pressure, heart structure, inflammation, and metabolic health. Recognizing some common heart conditions that are associated with obesity, and identifying evidence-based strategies to support heart health, including lifestyle approaches, medical treatment options, and feeling empowered to discuss your individualized care with your healthcare provider. So February is American Heart Month, and it's a great time to discuss how the disease of obesity is related to heart health. This gives us a time to pause and focus on how we care for our hearts and learning more about heart disease and understanding ways to reduce risk and recognizing how everyday choices impact long-term heart health. And heart disease is one of the leading causes of death in America, so staying informed can empower you to take an active role in prevention and early intervention if needed. The heart plays a central role in every function of our body, and protecting the heart not only is about preventing heart attacks or strokes, but also about supporting the health of the whole body over time. And when we talk about heart health, we're really talking about whole body health. But before we jump into heart health, it's important to start by defining obesity. Obesity is a chronic relapsing disease that's characterized by excess body fat and affects the way the body functions and increases the risk for other health problems. There are many causes of obesity, and it's not simply a lack of willpower that can cause the disease. There's appetite signals and hormones and genetic factors, medications, and environment that all play a role in the development of obesity. Obesity is commonly defined by using BMI, or body mass index, that takes into account your height and weight. And a BMI of 30 or higher falls into the obesity category. It's used because it's a simple measure and it helps to identify risk, but it's not always perfect. BMI doesn't tell us where fat is stored in the body or how it might be affecting a person's health. Because of that, providers might also look at other ways to assess adiposity, like a waist circumference or a waist to hip ratio, body composition, or other metabolic health markers. So how does obesity affect the heart? Obesity affects the heart through a combination of metabolic, inflammatory, circulatory changes, and higher levels of body fat are associated with the worsening of many cardiovascular risk factors, including abnormal cholesterol levels, elevated blood pressure, insulin resistance, chronic inflammation. All of these can increase the risk of heart disease. Increased fat mass and fat-free mass can also increase the overall workload and demand that's placed on the heart. And because of this, the heart has to pump more blood to meet the body's needs. And this increases the stroke volume and cardiac output, meaning that the heart has to work harder over time with each beat. Obesity also affects the heart at the metabolic level, and fat can begin to accumulate in and around the heart muscle, and inflammation within the heart tissue can further interfere with normal functioning. And from a circulatory standpoint, obesity is associated with increased blood volume and sustained increases in cardiac output due to higher stroke volume and heart rate. So over time, this constant strain causes the heart muscle to adapt. And these adaptations can lead to thickening and enlargement of the heart that's known as cardiac remodeling. And while this initially can help the heart keep up with the demand, it eventually, over time, can reduce the heart's efficiency and increase the risk of heart failure. So when we talk about obesity and heart health, it's important to recognize that where fat is stored in the body matters, and it's not just about how much weight someone carries. There's a strong correlation between overall obesity and abdominal obesity, but these are not always the same. So waist circumference can be a simple, practical way to measure abdominal obesity, and provides valuable information about how body composition and BMI alone maybe does not capture. So when used alongside BMI, waist circumference can help better estimate our cardiovascular risk. Another important measure is the waist to hip ratio. This measurement has been shown to predict cardiovascular mortality independent of BMI. So how do we quantify how much fat we have? In clinical and research settings, more advanced tools like CT scans or MRIs can directly measure body composition and quantify the amount of visceral fat or that fat that surrounds the organs. In everyday practice, we might use bioelectrical impedance or DEXA scans. These are more common to help estimate fat distribution. Visceral adipose tissue refers to the fat that surrounds the internal organs, and this type of fat can be particularly concerning, especially when we're talking about cardiovascular disease, because it's more metabolically active and inflammatory than the subcutaneous fat. That's the fat that's stored underneath the skin. Visceral fat can play a significant role in driving things like insulin resistance, chronic inflammation, and that's what can increase cardiovascular risk. So obesity is associated with several different heart conditions that affect the heart and the blood vessels. These conditions often develop gradually. They frequently overlap, meaning that one condition can increase the risk for another. And over the next few slides, we'll take a closer look at some of the most common cardiovascular and related conditions that are linked to obesity and discuss why addressing obesity plays such an important factor in prevention and treatment. So let's start by talking about hypertension or high blood pressure. Obesity contributes to high blood pressure through several circulatory changes. So as the body weight increases, there's an expansion of fluid volume and increased blood flow to many different tissues. There's also greater venous return, meaning more blood returning back to the heart and ultimately leading to a higher cardiac output. This higher cardiac output tends to rise because additional blood flow is needed to supply excess adipose tissue. But beyond fat mass alone, obesity is also associated with the growth of other tissues and organs, and the body starts to adapt to this increased workload and metabolic demands, further increasing the need for blood flow. Atherosclerosis is the process in which plaque builds up inside the arteries. The plaque is made up of cholesterol and inflammatory cells, other substances that gradually narrow and stiffen the blood vessels that make it harder for the blood to flow through. Early in this process, lipid accumulation or fat accumulation leads to the formation of what we call fatty streaks that can begin to develop long before symptoms start to appear. Obesity can accelerate these early changes through several mechanisms like insulin resistance, chronic inflammation. That visceral fat that we were talking about, the fat that surrounds the internal organs, is especially important in this process because it can promote systemic and vascular inflammation. And this is the inflammation that can drive each stage of the atherosclerosis from early plaque formation up to more advanced disease that can lead to heart attacks or strokes. Obesity affects the heart structure and function in pretty significant ways. So over time, the increased workload of the heart can lead to thickening of the heart muscle and enlargement of the chambers of the heart. These structural changes can impair how well the heart fills with blood and how effectively it pumps. So both systolic and diastolic function may be affected, which is the squeezing and relaxing of the heart. As these changes progress, they lead to enlargement and weakening of both the left and the right sides of the heart, which can increase the risk of developing heart failure. Obstructive sleep apnea is a sleep-related breathing disorder that's characterized by episodes of complete or partial airway obstruction during sleep. And these events can lead to drops in oxygen levels, and they activate the stress response and lead to more disrupted sleep. Obesity is one of the strongest risk factors for sleep apnea. And untreated sleep apnea is associated with a wide range of cardiovascular complications, including higher blood pressure, atrial fibrillation or abnormal heart rhythms, heart failure, stroke, pulmonary hypertension, and increased cardiovascular mortality. Other sleep-related breathing disorders can contribute to increased cardiovascular risk too. So now that we've discussed how obesity affects the heart, let's shift over to focus on what can be done to support heart health. So in the next few slides, we'll be talking about nutrition, sleep, physical activity, stress management, and how all of that can play a role. Nutrition is one thing that can play a central role in supporting heart health. Diets rich in minimally processed plant-based foods such as fruits, non-starchy veggies, beans, nuts, seeds, whole grains, yogurt, healthy oils are linked to better cardiometabolic outcomes. Research shows that increasing the intake of these types of foods can help protect against long-term weight gain and cardiovascular disease. Some things like sugar-sweetened beverages are associated with increased adiposity. Sodium intake is another important consideration. Most of our sodium comes from packaged and restaurant foods and can exceed the recommended levels of sodium of 2,000 milligrams per day, and that can contribute to high blood pressure and cardiovascular risk. Physical activity is one of the most effective ways to help support heart health. Current recommendations suggest around 150 minutes, if not more, of moderate intensity exercise per week or 75 minutes of vigorous intensity exercise. What does that look like? Moderate intensity exercise looks like brisk walking or dancing. Vigorous activities may include running or intense fitness classes. You can adjust with what works for you and what you enjoy. Sleep and stress management also play important roles in cardiovascular health. Poor sleep and untreated sleep apnea increases the risk of heart disease. Adults should aim for 7 or more hours of sleep per night and practice good sleep hygiene. Good sleep hygiene includes having a bedtime routine, sleeping in a quiet, dark room, turning off electronics 30 minutes before bed, trying to avoid caffeine later in the day or into the evening. Chronic stress can also contribute to unhealthy behaviors and negatively affect our heart health. So while positive mental well-being is associated with lower cardiovascular risk, that chronic stress can negatively impact our heart. Strategies like getting exercise regularly, having good social connections, relaxation techniques, maintaining healthy routines can all help to manage stress and help the heart overall. So there's research that shows treating obesity can improve cardiometabolic health and reduce cardiovascular risk. So in the next section, we're going to discuss what scientific literature tells us about newer therapies, including some GLP-1 medications, and how patients can work with your health provider to develop an individualized treatment plan. So the most important next step is starting that conversation with your healthcare provider. Every person's health history, risk factors, personal preferences are all different. So what's right for one person may not be right for another person. There's several different tools to manage obesity and reduce cardiovascular risk. And these could be things like behavioral strategies such as nutrition, physical activity, counseling, medications, and include newer options like GLP-1 therapies that have demonstrated both weight loss and cardiovascular health benefits. In certain patients, metabolic or bariatric surgery can provide significant and sustained improvements in weight and cardiovascular outcomes. These treatments are evidence-based, meaning they have been studied to improve health outcomes, and they work best when paired with ongoing lifestyle support and regular follow-up. So let's talk about GLP-1s. GLP-1 or glucagon-like peptide 1 is a naturally occurring hormone that's in our body and plays a key role in regulating our blood sugar levels, appetite, and insulin secretion. In addition to weight loss, GLP-1s have other mechanisms in the body that can lead to other health benefits, including cardioprotection, decreasing fatty acid metabolism, and increased insulin secretion. That helps with insulin resistance that can lead to obesity in the first place. There are a few FDA-approved GLP-1 medications currently, and there's more set to come in the future. Let's talk about one study that looked at a GLP-1 medication in cardiovascular disease. The SELECT trial was an international, randomized, placebo-controlled study that was designed to examine whether treating obesity with a GLP-1 medication, semaglutide, could lead to reducing cardiovascular events. This trial enrolled over 17,000 adults who had a history of overweight or obesity with established cardiac disease but did not have diabetes, and participants were randomly assigned to receive either weekly injections of semaglutide or of placebo. After a little over 3 years, the study found a statistically significant reduction in major cardiovascular events that includes heart attacks, strokes, and death from cardiovascular events. And overall, there was about a 20% lower relative risk of these major events in the semaglutide group compared to placebo. Importantly, these cardiovascular benefits were observed very early on in the study before participants experienced significant weight loss. And this could suggest that semaglutide has weight-independent effects on the heart, meaning that it improves cardiovascular outcomes not solely through weight reduction alone, but also through other metabolic and vascular mechanisms. So SELECT showed us that there's strong evidence that effective treatment of obesity can directly improve heart health and offers another tool to reduce cardiovascular risk for patients with overweight or obesity. There have been other studies on GLP-1 medications that have demonstrated cardiovascular benefit, including liraglutide, which is a once-daily injection in the LEADER trial in those with type 2 diabetes. Those in the liraglutide treatment group had a lower risk of occurrence of cardiovascular death, non-fatal heart attack, or non-fatal stroke in that time to event analysis. Another study, the SURPASS cardiovascular outcomes trial, this looked at tirzepatide versus dulaglutide in those with diabetes. Among patients with type 2 diabetes and atherosclerotic cardiovascular disease, tirzepatide was found to be non-inferior to dulaglutide with respect to composite death for cardiovascular causes, heart attacks, or stroke. Another trial, the STEP-HFpEF trial, demonstrated that semaglutide at the 2.4 milligram weekly dose had significantly improved heart failure-related symptoms, physical limitations, and exercise function, and reduced body weight compared to those in the placebo group in patients with obesity-related heart failure with preserved ejection fraction who did not have diabetes. So after the SELECT trial, semaglutide now has an FDA indication for the treatment of coronary artery disease in individuals with overweight and obesity. And while much of the focus has been on these incretin-based therapies, it's important to recognize that obesity management can include a wide range of different treatment options that may be appropriate for different patients. There's other FDA-approved medications that would include sympathomimetic agents, fat absorption inhibitors, medications that act on our reward center. These all have distinct mechanisms of action, and you can talk with your healthcare provider about which one might be right for you. These medications differ a little bit in expected weight loss, tolerability, contraindications, and cardiovascular conditions and considerations. Weight loss in the 5 to 15% of total body weight has been shown to produce clinically significant improvements in cardiometabolic health, particularly in reductions in blood pressure. The degree of weight loss may allow for dose reduction or discontinuation of antihypertensive medications in some patients. So while obesity treatment is foundational, many patients will still require additional pharmacologic therapy with medications to manage associated conditions such as hypertension and elevated cholesterol. And medications for blood pressure and cholesterol will remain the cornerstones of cardiovascular risk reduction, particularly in patients with established disease or possibly a higher baseline risk. Bariatric surgery is one effective long-term treatment for severe obesity as well as type 2 diabetes. In 2022, the indications for bariatric surgery were updated. Patients may qualify for bariatric surgery with a BMI above 35 or between 30 and 35 with an additional obesity-related comorbidity, or in Asian populations with a BMI above 27.5. This subgroup may be at higher risk for disease at a lower BMI. There's also higher remission rates of type 2 diabetes in individuals who have undergone bariatric surgery. So overall, obesity affects the heart through many different pathways, but there are several ways to lower cardiovascular risk. Even modest sustained improvements in weight, movement, nutrition, stress can lead to real health benefits. Obesity treatment can look different for every person, so I would encourage you to continue these conversations with your healthcare team and know that the support and evidence-based options do exist for long-term management. Thank you.
If you found today's Health Talk valuable, we invite you to help us continue providing trusted, science-based education about obesity and health. Visit obesityaction.org/donate to contribute today. Your generosity fuels our mission. Thank you for making a difference.